Is scoliosis a musculoskeletal disorder? A musculoskeletal disorder affects the muscles, tendons, ligaments, joints, nerves, and soft tissues. Anything that affects those things can potentially be considered a musculoskeletal disorder. Musculoskeletal disorders can cause a wide range of symptoms, from stiffness to pain to mobility issues to swelling and even weakness. Scoliosis causes the spine to bend and twist unnaturally, so therefore scoliosis is considered a musculoskeletal disorder that affects the spine, its surrounding tissues, and the entire body if it's left untreated. Now, some common symptoms associated with scoliosis can be wide-ranged, and it's very case-specific based upon the size and where the scoliosis is located. But the most common symptom is something included postural changes or visual changes to the body, and this is a result of structural changes that occur to the spine and the bones associated or connected to the spine. Other symptoms can be pain or mobility issues, flexibility, and stiffness. But first thing that we tend to see is postural distortion. It's a structural nature's postural problem. The more severe the scoliosis is, the more noticeable the effects can be. Now, scoliosis unfortunately can range widely in severity, from mild to moderate to severe and very, very severe scoliosis. The larger the unnatural spinal curvature is, the more severe the condition is. The severity of the condition is normally measured by something called a Cobb angle, and that's measured in degrees. And the bigger the Cobb angle, the further out of alignment the spine has become, the more structural the scoliosis become, and the more it can affect the body's symmetry from head to feet and everything in between. The best way to minimize the potential effects of scoliosis is to treat the scoliosis proactively, to keep the scoliosis as small as possible. Because as the curve gets bigger, it starts affecting more things. It starts becoming more and more structural. And as it becomes more and more structural, it leads to more effects. The first step in treating scoliosis is really to determine the underlying cause. And when we look at scoliosis, we typically divide scoliosis into three types: something called idiopathic, something called congenital, and something called neuromuscular scoliosis. Now, idiopathic is by far the largest type of scoliosis diagnosis that we see. And idiopathic means that the cause of the scoliosis is unknown. These cases can be highly responsive to conservative treatment, and this conservative treatment typically combines chiropractic care, physical therapy, corrective bracing, rehabilitative exercises, and stretching. Especially when these cases are treated early in the progressive nature, that this is when curves can actually respond very effectively. Now, there are other types of scoliosis cases. There's neuromuscular and congenital. These are considered atypical cases because they normally are not just an idiopathic case. Also, these cases sometimes can become more severe. Now, the more severe a curve becomes, the more likely it may need surgical treatment. But even in neuromuscular and congenital cases, if they're treated proactively, we can avoid the risk of invasive scoliosis surgery, which has some significant risks. The risk associated with scoliosis surgery, it can be quite extensive because scoliosis surgery is a type of spinal fusion, and spinal fusion involves fusing the spine into one solid bone. And this normally takes the most tilted vertebra on top of the curvature to the most tilted vertebra on the bottom of the curvature, using metal rods and screws to attach the spine, to hold the spine in place while it heals. And it's turning all these separate joints into one solid bone. And the risk can include many things like excessive blood loss during the procedure, infection, adverse reaction to the hardware. It can have long-term effects that can be loss of spinal flexibility, loss of range of motion, increased pain at the fusion site. A spine that is fused is definitely weaker and more vulnerable to injury. So when we're considering what can happen to scoliosis, if it's left untreated, it makes sense that scoliosis can be considered a serious musculoskeletal disorder if it's left untreated and it becomes more severe. Now, scoliosis can be highly responsive to treatment. So making a curve and keeping a curve mild, therefore this serious musculoskeletal condition that can require invasive spinal fusion now has a mild effect on the person's life and well-being, and has very little effect on what they do, and very little effect on their health over time. So it has this wide range, and this wide range really is how severe the curve becomes. There is never treatment guarantees, but because of this wide severity of ranges, the sooner you treat scoliosis, The sooner you find it, you treat it, and you reduce it, the less likely it's going to become this serious neuromusculoskeletal condition, and it can just become something mild that has really very little effect on your health and well-being. Thanks for watching. I hope you found this information helpful. If you have any questions about this topic or other scoliosis questions, type in the comments below and let us know. And finally, subscribe and hit the bell icon to be notified of when we publish new videos just like this.